Good evening. My name is Kelly Knapser, and this is a presentation for Health Informatics. So I'm going to begin with defining what cancer is. Essentially, body cells are dividing without stopping and begin to invade surrounding tissues in what is called metastasis. Cancer cells do not die and are constantly being produced in what is called tumors. And these tumors can be either cancerous or benign, and the cancerous tumors are what spread to other tissues and travel through the blood and lymph vessels into other distant tissues to form new tumors. So essentially, cancer is genetic, and what that means is malfunctions of genes are responsible for cell growth, DNA repair, and tumor suppression that end up supporting cancer proliferation. So, how do we obtain our information? Most prefer to obtain their information through the internet. This can be through reliable or unreliable sources. Regardless, the preference is through self-acquired health information before seeking medical attention. The basis is that people want to be prepared to talk about these issues with their physician or alternative care provider. This self-acquired health information has actually been known to lead to greater potential of screening adherence and also cancer regimens. So as you can see throughout all of the different sources of obtaining health information, internet searches were definitely the number one. Whereas the second leading one was by provider. And this was in correlation with books, pamphlets, friends, family, any other different kind of sources that you may get the basics of your information from. That is what was pulled. Trust is an important factor in any kind of provider-patient interaction. It is defined as the psychological state comprising the intention to accept vulnerability on the basis of positive expectations of the intentions or behavior of another. So research actually indicates that trust is important for patient outcomes. This includes screening, adherence to regimens, and participants in this data set actually favored provider information versus the government and health organizations as their counterpart. Information overload is a heavy concept within cancer health information. There are so many recommendations out there that people don't know which ones to follow, which ones to trust. And this graph clearly defines how people feel pertaining to the amount of information that they are being given. This may play a role in other future programs as far as let us narrow down the actual recommendations that we are giving to people, and let's make them simple. Let's make them easy to understand for each different person, because people are seeking this information from different sources, whether it be internet provider, pamphlets, books, and you have to think about the level of their understanding and also their likelihood to participate in these recommendations. If they're too complicated, people are not going to want to pursue these. So let's talk about the stakeholders and the health-related information. There are multiple areas that stakeholders accounted for. The health-related information affects 4 different levels. These are government, population-based, academic and research, as well as medical. All stakeholders equally influenced by cancer health issues with many feedback loops. So here is a graphic of the health-related information response. As you can see, there are many stakeholders that have been identified. These include cancer research centers and academia, data analysis, and statisticians, and this product leads to government organizations which filter their information into the hospitals and eventually the public. And the population leads to this response, which is seen in these feedback loops. So the feedback loop is we are generating policy, and that policy can lead to another feedback loop to different areas, which is constantly being reevaluated. So very briefly, I would like to go over this infographic that has been generated. Infographics are valuable tools that we use to quickly and clearly present information that we feel is very valuable. They provide a visual summary of the points that we are trying to make. So in this infographic, we can see from the hints data set that 6 in 10 people search for information online, and that trust is important in communication, with 68% of people trusting doctors, followed by the 34% trusting in the government organizations. And a trend that we weren't really prepared for was 17% sought medical information from their provider first, whereas 69% sought information online. And as we can see through this, 73% by the recommendations that were presented to them. Over all of this information, we can see that there is a need to disperse this information and make it versatile between different demographics. So with this infographic, we can begin to generate our questions that we are already asking. Do we trust doctors? Is internet health information legit? How are we responding to that information? And how are racial disparities influenced? So this is a graphic representation of the demographics that were displayed through the HINTS survey. So as you can see, a very big majority, about 83% of this survey was Caucasian based. And this skewedness may fail to address statistical modeling that is important in racial disparities. However, these racial representations through this graph lead to greater and deeper questions that could possibly be asked in the future coming years. So, wrapping up with a call to action. With this cancer health information, we can conclude that more work needs to be done to incorporate greater racial variation in data. Organization needs to help make information versatile between different demographics, and cancer health recommendations should be simple and as uniform as possible between different types of cancer. Now we know that each type of cancer has its own set of protocols and different techniques that have been proven and set as a gold standard. However, people are starting to seek other options because they don't know what to trust. So we need to make that decision for them very clear by giving them the correct information and as simple as possible to ease their decision and to help them on their journey to hopefully a cancer-free life. Thank you. Program of Public Health through UNE. This presentation is in regards to cancer health information, and it is from a public health perspective.